When you go to the dentist, you know they're going to look at your teeth, but that's not all that's important for your oral care.
And Michaela Davidson, who is a dental hygienist at Polish Dental, is joining us now. Michaela, thanks again for being here.
Yeah, thanks for having me.
Hi, Michaela.
Hey.
So September is Gum Care Month.
It is.
Which is, just as important probably as your teeth.
It is.
Tell us about that.
Yep, so the gum tissue is kind of what helps support your teeth. Obviously, your teeth are held in place by bone, but the gum tissue is kind of what fills it in and keeps those teeth stable. So if you're having a lot of inflammation, if you're having signs of gingivitis, it definitely can impact the way that the teeth are held in place, affect the bone that's holding the teeth in place.
So what is the difference between like a healthy gum and gingivitis?
Right, so gingivitis is going to present in a patient as really red, inflamed gum tissue. You're going to notice some bleeding when you're brushing. It's probably going to be pretty tender when you're brushing too. One thing that we tell patients all the time is that healthy gum tissue should not bleed. So people come in a lot of times and they think that it's bleeding because maybe they're brushing too hard or they're traumatizing things, and that can be the case. But more often than not, if your gum tissue is bleeding, it's because there's something else going on, like gingivitis. Compared to a healthy mouth where you're not going to notice the bleeding, the gum tissue is all going to be a more uniform color and a little bit tighter around the teeth.
Mm-hmm.
And what can you do to prevent it or maybe treat it if you do have it?
So if you're noticing that your gums are bleeding, if you're getting some inflammation, the first thing is to really buckle down and brush and floss twice a day. Keep everything as clean as possible. Usually that will help. If you haven't been brushing kind of towards the gum line, you're probably going to notice some bleeding. It's probably going to be kind of sore, but I always encourage patients to just keep doing it. Within a week or two, that gingivitis should settle down. Sometimes there are more things going on, such as it's been 10 years since you've had your teeth cleaned and you have a lot of buildup. That can also contribute to gingivitis. And so going in to see your dentist, getting a professional cleaning by your hygienist will be another thing you can do to really kick things off and get things healthy again.
And what happens if you have gingivitis? It's such a fun word to say.
Gingivitis is a great way
what
to
happens
warm
if you
up
have
your
it but
tongue.
you just leave it untreated for a long period of time?
Yeah, so eventually that's going to cause some bone loss around the teeth. So when you go into the dental office, a lot of times we're doing probe measurements, which is where we take a little instrument, it looks kind of like a ruler, and it goes into this little space between your tooth and your gum tissue, and then depending on how deep it falls into this little pocket, that tells us how healthy everything is. So when we do these, it's measured in millimeters. We want these numbers to be 1s, 2s, or 3s. That means everything is healthy. 4 and above is bone loss, and basically the higher the number, the more bone loss that you have. So gingivitis is going to present. We're going to see probably some 3s, 4s, maybe some bleeding when we're checking. If we leave it alone and don't do anything, over time that's going to progress, and you're going to see more bone loss occurring around the teeth. And actually more people lose teeth due to periodontal disease than anything else. So it's definitely something that if you get it under control right away when it's in that gingivitis stage, it's going to prevent periodontal disease in the future and potentially the loss of teeth.
But hope is not lost if you have gingivitis.
Right. Gingivitis is totally reversible. So if you, like I said, buckle down on brushing and flossing and really work hard to keep things clean, your gum tissue can definitely stabilize and become healthy, and you do not have to worry about periodontal disease.
All right, great advice.
Yeah, I love it.
I do have to ask about the loose tooth conversation.
For sure, yeah.
And whether you still hear from people with the tying the loose tooth to the door.
All the things. Like, we've heard of people using remote controlled cars to get them out, the door, Nerf guns, all the things, they still use them often.
My goodness.
Yeah.
It's so fun.
Yeah, I guess.
Yeah.
I got to see that Nerf gun video. But anything else you'd like people to know today, Michaela?
Yeah, I think if you're someone that you think you may have gingivitis, definitely make an appointment at your dental office and have everything evaluated, because the longer you wait, the more damage will be done. So kind of taking care of things right away, being more proactive about it, will definitely give you your best outcome.
Wow, good advice for dental and good advice for life.
Yes.
Michaela, thank you so much for joining us today.
Yeah, thanks for having me.
All right, and Polish Dental is located in Bismarck and accepting new patients.
They utilize state-of-the-art technology with gentle care and create personalized treatment plans for their patients' individual needs.
To schedule an appointment, make sure you call them at 701-222-4746 or 222-GRIN.